I went to meet Jim Gee, the former director of CFS for the Department of Health in London. He's now one of the leading authorities on healthcare fraud in the world. The estimate for the amount of fraud in the NHS in Scotland is about 1%. Is that realistic?
We currently have 15 years of data covering 14 different types of healthcare expenditure. We're currently finding just under 7% on average of that expenditure is lost to fraud.
7% of the whole of the NHS budget in Scotland?
Well, if Scotland is in line with the rest of the world, that's what I would expect to see.
If Jim Gee is right, as much as £800 million could be being stolen from the NHS in Scotland every year. But remember, the NHS's estimate puts fraud levels at just £110 million a year. Now that would mean that Scotland is the best in the world at deterring fraud. Are we the best in the world?
I think we are certainly there or thereabouts. We are very successful in what we do. The health service in Scotland is very well run, and as I've said, the frauds are committed by a small minority. It's a hidden crime. It's a difficult crime to quantify. There have been a number of studies, and Mr G's put fraud between 3 and 8% in any public sector organisation. There's nothing to indicate that the health service would be any different from that, but we don't believe that we want to quote massive figures when we can't fully justify them, but the losses are certainly a considerable amount of money.
We're looking at somewhere between 300 and 800 million going astray.
If we could save that amount of money, what impact would it have on patients? I mean, that's brand new hospitals every year. That's enormous amounts of doctors, nurses, operations.
It is. It's an enormous amount of money diverted from patient care. People not getting the treatment they need, sometimes having to wait longer for that treatment. And that's why it's an important problem which needs to be tackled very seriously with an appropriate level of investment in that work.
But what we're really focusing on is deterrence. We're trying to make every effort to ensure that the money doesn't go out the front door in the first place. Rather than trying to recover it after we've lost it, what we're focusing on is deterrence so that people don't actually commit the fraud in the first place. And that's a far more cost-effective way, and it protects the health service. It's no use having lost the money, then trying to get it back. What we're really saying is we're not going to lose it in the first place.
My experience of the NHS counter-fraud service in Scotland is that they're very effective, but I don't think they have the resources they need to have the impact they would like to have.
The NHS is a lifesaver, but it needs every penny it can get. The Stuart Craig case and the others we've highlighted reveal the hidden scale of fraud against our health service. That money could employ 37,000 nurses. So the consequence of stealing from the NHS is poorer care for all of us when we're sick, just when we need it most.